today is going to be about mapping global health epidemics and how data, insight, and execution will help us end infectious disease outbreaks. So I'm going to start with a story about polio from rural northern Nigeria. On a hot day in May 2014, a group of health workers grabbed GPS-enabled tablets and hopped on the back of a motorbike. These tablets had satellite maps on them that showed settlements that no vaccination team had ever visited. And these health workers were on a mission to go and find those settlements. They rode through small villages and farms until they reached a stream that the motorcycle driver refused to risk his bike on. So they got off the bike and they walked the last 15 minutes on foot. Suddenly, they stumbled into the middle of a large village where they were greeted with hundreds of smiling faces, all curious to know why these strangers had come to their settlements. So this settlement had over 100 children under 5 who had never received a single dose of polio vaccination. Over the next 6 months, these health workers and many others traveled to over 1,000 unmapped settlements across northern Nigeria and vaccinated thousands of children who could have lost their ability to walk. So how could this happen? How can we systematically have missed thousands of children when our goal is to reach every last child? We missed them because we didn't know they existed. By improving maps like this, we can find these children, we can map or we can vaccinate them, and we can prevent the spread of many other infectious diseases. So here's how we do it. In order to eliminate a disease, we need to create a cycle of data, insight, and execution. So first, we need to collect the data. So there's a couple different ways that we can do this. There's the fancy ways, like hiring satellites to take new images, or feature extraction using supercomputers. But when you need to know the names of settlements and how many people live in these settlements, then data collection generally looks more like this. Or like this. So we realized that in order to eliminate polio in Nigeria, we were going to have to map all of northern Nigeria. That included over 170,000 kilometers of roads, 20,000 health facilities, and 150,000 settlements. That's the equivalent of mapping all of California, but without having access to the I-5. However, that data collection allowed us to go from having maps that looked like this to maps that looked like this. All right, so now we have the data. Now we need to make it more meaningful by adding a bit of insight. So how do we do that? So one way is we can add population data to the maps so that we can determine coverage rates. Another way is we can make detailed day-by-day trip maps called microplanning maps for the vaccination teams. But it's not just about having the data. You need to actually use the data to change how people execute their work. In Nigeria for polio, we do this by providing GPS trackers to the vaccination teams so that we can actually determine if they are reaching all of the locations that we have mapped. This map, the green dots on this map, show us that they have reached all of these locations. But sometimes execution isn't this easy. And we actually have to come up with more innovative ways for healthcare workers to find these locations, like providing them with GPS-enabled tablets that have those little arrows on them so that they can point them in the right direction of these settlements. And then once you have done all of that, you have to create this cycle of data, insight, and execution over and over again. Once you've established this practice, then you can modify your execution approaches based off of what you have learned. So our work on polio has been mostly about prevention. But everybody knows that another huge risk to public health is a disease outbreak. So here's how we use this same model to help manage the Ebola outbreak in Lagos. So data. We collected the GPS coordinates of the houses of everyone who had come into contact with the virus. Insights. We created maps and routes for healthcare workers that would allow them to go and visit every single person twice a day. And execution. We provided these healthcare workers with mobile devices to use during their check-in visits that allowed them to make sure that they reached every single person, and to also make sure that if somebody was exhibiting signs or symptoms of Ebola, that they were flagged immediately. We went through this process of data, insight, and execution not only once a day, but twice a day. So why did this work? The data allowed us to identify people infected with Ebola immediately and remove them from their community. We can use this same cycle for other big challenges too, like malaria. Many organizations are already using some kind of GIS technology to track their own individual interventions. But what we need to do is we need to get all of that information into one location onto one map so that we can better identify, so that we can better target our interventions and our budgets in the areas that need it most. And that way we can see the bigger picture in real time. And of course, GIS technologies can help us to track the delivery of a new malaria vaccine. As a global health community, we need to think bigger. Reducing an infectious disease by some arbitrary percentage is not effective. Unless we eliminate it, it's going to keep coming back. It's all or nothing. And GIS technologies are a key to helping us reach zero. Thank you.